Okay, so good morning, students. Can you all see this screen? Is it visible?
Yes, ma'am.
Okay. So yesterday we were discussing about what we discussed about aorta, no? It was a part of your doubts. So we have discussed. So today, yesterday, since yesterday, uh, you all said like hernia. So today we will be discussing about hernia. So this is a quick revision. So this is hernia. So hernia actually it's what? uh, Hernia is a protrusion of an organ. Protrusion means what? Means swelling out or else coming out, you can say. Okay, like some parts of the internal organs. This is the abdomen, right? So some parts of the internal organs, it will come out through through where? Through a weak point. Weak point means what? Since this abdominal wall is weak, so because of the pressure pores in the internal side, so it will come out, it will swell out in this manner. Can you see the picture?
Yes, ma'am.
Okay, so it will come out in this manner. Okay, and hernias, when it used to be present, it used to be present at birth. Sometimes it used to be present at birth also, right? Because of the weakness in the muscle, no? In the weak muscle. So it occurs sometimes in birth, means congenital, or sometimes they may develop anytime, means anytime. If not congenital, that means birth, it can occur anytime. Okay, is it clear this portion? Yes or no?
Yes, ma'am.
Okay. So I have already discussed like a piece of valve means it will come out. Okay, means it's through the weak point. Since this is the weak point, so it will come out in this way. Understand? Means in the muscular part of the anterior abdominal wall. Anterior means what? Means front. No? Or obviously it won't go back. Means posterior, it won't go back. It will come at the front portion. It is in the abdominal wall or an existing opening. Means here. It means this. Okay. So this is about hernia. And this hernia, it occurs sometimes. And this hernia, no, it mainly occurs when? It mainly occurs if a person what to say, if a person lift up some heavy weights, no? So this is just a picture, like if they lift up like a weight, especially men, they lift up no, heavy weights. So if they lift up weight, what will happen? Uh, since the abdominal wall is weak, they can't to say they don't have that much capacity or capability to lift up weights too much because of the heavy load. So that's why it will push that intramuscular wall. It will push out, and ultimately, what will happen? Ultimately, uh, the um, the anterior abdominal wall, it will swell. Understand? And this hernia, it occurs when there are intermittent increase. Intermittent means what? Means not occurring regularly, or else you can say not continuous. Okay, so it occurs in this manner. Did you understand in this portion?
Yes, ma'am.
Yes,
Okay,
ma'am.
okay then. Now let's talk about sites of hernia. So hernia also you have got like various sites. I've included two more, huh? We will discuss in the next. We will discuss. I've included two more, so I will give you notes on that also. Just after your class, I will send you the in PDF. Okay. Okay. First is this. In which site you will find first is let's talk about inguinal hernia first of all. So the inguinal hernia, so this is the inguinal portion. This one. In this portion, I have shown you two pictures. First is this and this. So this is the inguinal hernia. So the inguinal hernia, what happens? Like puff out in the inguinal region. Understand? This is the skin. This is the small intestine, and these are some fats, and this is the abdominal wall. So it comes out since the muscular wall is weak in this portion, that is the inguinal side. Okay, and in this inguinal side, what does it contain? It contains some spermatic cord, some sperms that in this area it contains, and it occurs in the male, and round ligament in the female. Means sometimes it occurs in the female also. Means in this region it occurs. Okay, in this inguinal region. It occurs in male as well as in the females also sometimes. So this is it. This is the skin. This is the small intestine. These are the fats. This is the abdominal wall, and it's pushed since it's like weak, this muscular area, this muscular side. So they are pushed like that. So and ultimately what happens, like the abdominal wall like puff out in this manner. Okay, is it clear? Inguinal hernia.
Yes, ma'am.
Okay. Okay, next is femoral hernia. So this is the femoral hernia. So in the femoral hernia, what will you find? You will find in the femur region. From where your femur bones. Yes, it begins here in this femur canal. It occurs where? Through the femoral artery. Okay, and your lymph vessel, and passes from the pelvis to the thigh. Means this is your pelvis and thigh, your thigh area, in this area, like the femur like, occurs. So this is the picture. Is it clear?
Yes, ma'am.
Okay. Okay. Next is umbilical hernia. So the umbilicus. Okay. So this is the umbilical hernia. So this is the abdominal muscle. This is your skin. So same thing. Okay. So it occurs in the umbilicus. In the umbilicus region it occurs. And this umbilical hernia, what happens? It occurs in the umbilical cord. You know ना umbilicus navel, ये navel नाभि जो है वहाँ पे रहता है, ठीक है? And it occurs from the placenta and enters the fetus before birth. That means what? Means it mainly occurs like when a woman is pregnant, right? When a woman is pregnant, uh, gradually by then only, like it usually occurs by then. You understand, जब woman औरत प्रेग्नेंट होता है उसी वक्त ही ये अम्बिलिकल हार्निया वहाँ पे रहता है, ठीक है? Did you understand what I meant to say?
Yes, ma'am.
Before birth only it occurs, before delivery, before the baby comes out, no? It means it occurs by then. Okay, next is incisional hernia. So this is incisional hernia. So this is the So this is the umbilicus, right? Umbilicus hernia. So just outside of that, the incisional hernia occurs. So this is the incisional hernia. So this incisional hernia, why it usually occurs? It usually occurs because if there is any surgery going on, if there is any surgery, and because of too much stretching, obviously they will stretch the skin. So it means if they want to do some internal surgery, obviously they will like stretch out the skin, they will cut the skin, and they will insert all those surgical instruments, isn't it? They also obviously stretch होगा उसी जगह पे. So uh, again they will stitch this area, and ultimately what will happen? Ultimately this area will become weak. So that's why it usually occurs. hernia, that is in the incisional hernia. तो ये जो incisional hernia में क्या होता है, ये ठीक नाभि के ऊपर में रहता है। और ये incisional hernia क्यों होता है ज़्यादातर, क्योंकि ये बहुत मतलब सर्जरी करने से, ऑपरेशन वगैरह वो सब करने से क्या होगा, ये जो जगह है, ये जो एरिया है, बहुत बार मतलब स्ट्रेच होगा, है कि नहीं, मतलब सिलाई करेगा, फिर से ऐसे टानेगा, ठीक है, तो इसकी वजह से मतलब अपने आप कमजोर हो जाता है ये जगह, तो इसलिए इंसिशनल हार्निया होता है, ठीक है। Did you understand incisional hernia?
Yes, ma'am. Yes, ma'am.
Okay. Okay. Next is hiatus hernia. Okay, so this is the hiatus hernia. So this is the this is the esophagus. This is the diaphragm. This is the stomach, right? So hiatus hernia. How does it occur? It occurs in the upper part of the stomach. So this is your stomach. It's not it, and you can see no, some puffing out, some kind of lump here. It's not that ये जो थोड़ा फूला है, देख सकते हो, है कि नहीं, ये तो सीधा नहीं है कि नहीं, ये तो सीधा नहीं है, नॉर्मल नहीं है, पिक्चर देखने से ही पता चल जाता है, लेकिन ये थोड़ा मतलब फूला है, it's not it. So this is the hiatus hernia. So it occurs where in the upper part of the stomach. So this is your stomach. It occurs in the upper part of the stomach, and the stomach like is pushed. Okay, the stomach, since they are pushed, like in this diaphragm area, means in your chest area, so it usually occurs. But here what happens, strangulation does not occur. Strangulation means what? Choke, like gala dabana. Okay, I mean sometimes you grab a person's neck ना, sometimes like this, गर्दन दबाना, ठीक है, वो मतलब यहाँ पे नहीं होता है, it's just like that, okay, it's just the, what to say, it's just uh, a malfunction, you can say, like not exactly like they won't affect you like from breathing, like shortness of breath, not like that, okay, like it's just like that, abnormal, but nothing will affect you. It won't affect your breathing capacity or breathing capability. Your normal function will go on. It won't hamper anything in you. तुम लोग का मतलब शरीर में कुछ मतलब हानिकारक नहीं होगा, ठीक है, अपने आप मतलब नॉर्मल ही रहेगा। बात सिर्फ ये है कि ये जो एरिया पे ये जो स्टमक है, सिर्फ यहाँ पे मतलब वो होगा, थोड़ा चेंजेस होगा, थोड़ा एबनॉर्मल हो जाएगा, थोड़ा फूलेगा, लेकिन सांस लेने में ये सब में मतलब कुछ इफेक्ट नहीं होगा, कुछ दिक्कत नहीं होगा, ठीक है। इज इट ओके, मींस टू अंडरस्टैंड हाइटिस हर्निया?
Yes,
Yes.
ma'am.
ओके। Okay, next is so hiatus hernia, it has got two types. ये जो hiatus hernia है, दो parts है, एक है sliding hiatus hernia और दूसरा है rolling और paraesophageal hiatus hernia। पहले हम लोग sliding hiatus hernia देखते हैं। Okay, so first let's see about the sliding hiatus hernia. So this is a sliding hiatus hernia. So this sliding hiatus hernia occurs when it occurs in your stomach area. This is your stomach area, and this is the esophagus area. And it occurs in these two areas. That is your esophagus area and your stomach area. It occurs like in and into and out of the chest. Means what means it will occur, it will hamper in these two areas, is your chest area, right, this chest area and your stomach area. It will occur in these two places, and they are like small, they are not that much huge or large, they are small, and they do not cause any symptoms. I've already said now, like they don't harm you, they don't do anything, it's just like that only. and there are no symptoms, and yes, like treatment is not even required for this thing also. तो ये जो स्लाइडिंग हाइटस हार्निया है किन अंगों के बीच में होता है अ, हम लोग का जो चेस्ट एरिया है, ठीक है, और मतलब ईसोफेगस, उसके बाद आता है ये जो चेस्ट एरिया मतलब डायफ्राम एरिया और स्टमक, हम लोग का पेट जो है, ये दोनों के तरफ में ज्यादातर होता है ये जो स्लाइडिंग हाइटस हार्निया है। लेकिन यहाँ पे क्या होता है, यहाँ पे सिर्फ फूलता है, ये जो जगह है सिर्फ फूलता है, मतलब कुछ सिम्टम्स नहीं है, कुछ हम लोग के शरीर के लिए कुछ हानिकारक नहीं है, कुछ इफेक्ट नहीं करता हम लोग का शरीर को। और यहाँ पे ट्रीटमेंट भी इसका ज़रूरत नहीं है, सिर्फ मतलब ये है मतलब एबनॉर्मलिटीज है, सिर्फ वही है, ठीक है। ओके, डिड यू अंडरस्टैंड स्लाइडिंग हाइटस हर्निया?
Yes.
ओके ओके, नेक्स्ट इज रोलिंग rolling hiatus hernia, or else you can say para-esophageal hernia. Okay, okay. So this rolling or para-esophageal hernia, what happens? There is like a junction in between. What means there is some problem in what in the esophagus. This is the esophagus and the stomach. Okay, there is some like abnormalities in between your esophagus and your stomach, and this portion, this stays within the abdomen on the top part of the stomach. Okay, means here, this is your stomach, right? So they will be situated at the like at the upside of the stomach, and this is your chest cavity, right? Like puff out like this, like the whole thing, it will puff out upside of your chest area, chest cavity. But here in the sliding hiatus hernia, it was not like this. Like it was equal. It's not in your diaphragm as well as in your stomach, or like it was there. But in the rolling or esophageal hiatus hernia, what will you find? You will find like totally everything is like puffed out in the chest area, means in the chest cavity. It's not like whole thing, the whole thing. Yes, is it clear? Rolling hiatus hernia or else you can say para-esophageal hernia. यहाँ पे क्या होता है? यहाँ पे esophagus और stomach जो है, इन दोनों के बीच में ऐसा होता है, मतलब पफ होता है, फूल जाता है। और यहाँ पे क्या मिलेगा? ये जो चेस्ट एरिया है, हम लोग का छाती एरिया जो है, पूरा मतलब स्टमक यहाँ पे आ जाएगा, ठीक है। और यहाँ पे क्या होगा? यहाँ पे पूरा मतलब हम लोग का जो स्टमक है पूरा मतलब निकलेगा ऊपर, ठीक है, पूरा पूरी मतलब यहाँ पे आ जाएगा। ओके, डिड यू अंडरस्टैंड दिस रोलिंग वन?
Yes, ma'am.
ओके ओके, नेक्स्ट इज epigastric hernia. So this is the epigastric hernia. Understand? This is the umbilical. We have already discussed umbilical. So this is the epigastric. Means in this area it will be there. In this area means just in between your breast, na, it will be situated. Not in between the breast, sorry, like just a bit down. Okay, means a bit down, not that much down. A bit down, it will be situated. So means in the stomach area only, like it will be situated. Is it clear? Epigastric.
Yes.
Okay. Okay, so these are the two hernias that I have given you extra, huh? So I have already made the notes also in this hernia. So I will send you this after this class. Okay. The next one is peritoneal hernia. So this is a peritoneal hernia. So peritoneal hernia, like what will happen in peritoneal hernia? In the peritoneal hernia, you will find that a loop of valve, may herniate through the epilopic foramen. So what will happen here means here in the peritoneal hernia, in the peritoneum, there will be uh, protrusion. It will puff out. So in which area it will be there? So it will be here in this area. So that is the epilopic foramen. So this area is known as the epilopic foramen. This is your stomach. It's not it. This is your stomach. This is your gallbladder. This is a kidney, right? So it will be here, epilopic foramen, or else you can say of Winslow. This one, Winslow. This one, epilopic foramen, or else you can say Winslow. Winslow, Winslow. Okay, so it occurs here. In between here means epilopic foramen is the opening of the lesser omentum. So this is the lesser omentum. Okay, this is your stomach area. Don't get confused. So this is the lesser omentum, or else you can say lesser curvature, which separates the lesser curvature and the greater curvature. Understand, of the peritoneal sac. This is the peritoneum. This is your peritoneum, right? So the epilopic here it occurs in this area. It is the epilopic foramen, or else you can say of Winslow. So here in this area, can you listen to me? Can you hear me, students?
Yes, ma'am.
Okay, so let me repeat again. So in the peritoneal hernia, in which area this thing will occur, like puffing out, it will occur in this area, epilopic foramen, or else you can say of Winslow. So epilopic foramen exactly is what? It is the opening. It is the opening of the lesser omentum, this one, and the greater curvature. In the peritoneal sac, this is the peritoneal sac. All this area is the peritoneal sac. So in this area, it will occur. Is it clear?
Yes, ma'am.
Okay, next is congenital diaphragmatic hernia. So from the name itself, congenital. Congenital means what? Means for birth. It's not it. At birth. Okay, so congenital diaphragmatic hernia. What happens here in the congenital diaphragmatic hernia? You will find that it mainly occurs in babies. Okay, means newborn babies. It usually occurs here. So you have got two lungs, right? Right lung and the left lung. So in this hernia, that is the congenital diaphragmatic hernia, what will you find? You will find that the stomach and the small intestine, they will move upside of this. That is in the chest cavity, in the chest area. It will push. There will be some force, and because of that, it will hamper this left. Can you hear me? Yes. Huh. Okay. So because of these abnormalities, what will you find? You will find that there will be a problem. The baby will find problem in what? In developing the lungs. Understand? Means they will find like hindrance, or else you can say they will find some problem in the development of the lungs. Since there is some blockage, right? Because of Wait, let me show you in the next one. Okay, this one, can you see it? So this is the lung. So this is the normal one.
मैम
हाँ.
हेलो मैम
Yes,
मैम
can you?
आपका स्लाइड मैम
हाँ हाँ
हेलो मैम
हाँ हाँ
मैम
बोलो.
आपका स्लाइड जो पेरिटोनियल में है
कहाँ पे है?
पेरिटोनियल हार्निया
Is it? Okay, let me. अभी अभी कौन सा हार्निया पे है?
मैम सेम
सेम सेम. ओके, वेट. हाँ.
मैम
Okay, what about now? What about now? Hello?
मैम अभी दिखाई नहीं दे रहा है मैं बाकी स्टूडेंट को पूछ के देखने से
Wait. Hello students, can you see the screen? Is it visible?
No, ma'am.
No.
No,
Wait. Huh? Just wait. Can you see now? Is it visible? Hello?
नो मैम नो
Still
मैम
no?
no, ma'am.
But can you see the peritoneal hernia? Peritoneal hernia, can you see it?
नो मैम
You can't see anything right now.
यस मैम
What can you see then? What is visible now?
Ma'am, you.
Only me. Okay. Wait, I'll try again. Okay, I'll just explain. Then I think there are some problem. Okay, what about now? Can you see it? Hello? Hello? Hello, can you hear me?
यस मैम
Can you see now the screen?
नो मैम
No. Okay, I'll just say it verbally, huh?
No, ma'am.
I'll just say verbally then. You have understood till peritoneal hernia, na? Till peritoneal hernia, it's
Yes,
fine, na,
ma'am.
with you all. Okay. Okay.
मैम एक किस
Huh?
तरह का एपिगैस्ट्रिक मैम हार्निया Epigastric hernia.
No, like you were able to see till peritoneal hernia, no? Till where you were able to see? Means till which hernia you all were able to see the slide?
Peritoneal hernia.
What hernia? Hello, can you see now? Is it visible now?
No, ma'am.
Still no.
Ma'am.
Okay, till which slide you were able to see? Which
Peritoneal hernia.
peritoneal hernia, na? Okay. Okay, the last hernia is, I'll just explain verbally if you are not able to see them. Because I will send you pictures also in this congenital diaphragmatic hernia also. Okay. Okay, so in the congenital diaphragmatic hernia, what happens? Uh, Diaphragm, from the name itself, diaphragm. So in the diaphragm area, it will hamper. So there are two kidneys. It's on the right and the left side both. So in the diaphragmatic, congenital diaphragmatic hernia, what happens? It mainly occurs in babies, newborn babies. So these internal organs, the internal organs, that is the small intestine and like the stomach, like they will push towards the diaphragm. Understand? Means this is your diaphragm, right? So they will push it. So ultimately, what will happen? It will hamper the left lung. The left lung, it will hamper, and because of that hamper or that disturbance, what will happen? Uh, they will uh, prevent. They will prevent like from normal development. I mean, the left lung, no, it won't be able to develop further because of this congenital diaphragmatic hernia, because the intestines, they are pushing, the small intestine, they are pushing, right? They are pushing right uh, here, that is in the left lung, they are pushing. So that's why uh, the lung, they won't be able to develop further. So this is about the congenital diaphragmatic hernia. Is it clear? Hello.
Yes, ma'am.
Okay. I will send you the picture, huh? Means in PDF file I'll send you. But you know that in the left lung, there used to be abnormalities. Why? Because the stomach side, na, the the small intestine side, like they will push in the chest area and they will disturb the left lung. And the left lung, like they will find difficulty in what, not like difficulty exactly, like they will find some disturbance in the development of the left lung. So this is about the congenital diaphragmatic hernia. Okay, is it clear? It's clear, no? Today's class, hernia.
Yes,
Okay. Okay,
ma'am.
then that's all for today's class. I will send you. I will really send you just right now, right after leave the class. I'll send you. Okay, today, Srijana, are you there? Srijana, Srijana is not there. Okay, from second sem, who will take yesterday?
Yes.
Second sem, who will take the responsibility? So far, okay, Rashmi Sonwal.
Yes, ma'am.
Okay, please send me the attendance, second sem. And
Okay, ma'am.
from fourth sem, Krishna. Oh, it's not Krishna, sorry. Which person? Which person? Can you hear me?
Yes, ma'am.
Okay, send me the attendance for fourth sem, huh?
Yes, ma'am.
As soon as you are done, tell me, I'll end the class.
Yes.
Done, ma'am.
Done.
Done, ma'am.
Okay, then thank you everyone.
Yes, ma'am.
Done, ma'am.
Have a nice day.
Thank you.